So with that, I'm going to hand it over to Nicole. Actually, let me do an introduction myself, and we'll introduce the rest of the staff, the DHHS staff, and then Nicole can get us kicked off. My name is Karen Mason, an Associate Director at the Office of Aging and Disability Services, and I oversee the Healthy Aging and the Long-Term Supports and Services program here at OAHS. Nicole?
Hi, good morning. My name is Nicole Roney. Don't even know my last name today. I am the Long-Term Services and Supports Program Manager for the Office of Aging and Disability Services. And I would like to turn it over for our partners at the Division of Licensing to introduce themselves. So Joseph Zamboni.
Hi, everybody. Joe Zamboni. I'm the Chief Operating Officer here at the Division of Licensing. I'll kick it over to Heather.
Good afternoon, everyone. My name is Heather Hyatt. I'm the Associate Director for Community Healthcare Programs here at the Division of Licensing and Certification. We also have Jonathan Leach.
Hello, everyone. My name is Jonathan Leach. I'm the Compliance Manager at the Division of Licensing and Certification.
And I think Nicole Gannett is with us as well.
Hi, Nicole Gannett. I'm the Program Manager for Assisted Housing.
Excellent. Thank you, everyone. I'm going to go ahead and try to share my screen. Apologies. I'm trying to manage some late admissions into this group. All right, I'm going to ask my state staff to confirm that they see what they're supposed to be seeing here today.
Yes.
Okay, excellent. So before we get started, I just wanted to kind of go over a few housekeeping things. We are recording this, as Karen mentioned, as she opened up our session today. So this will be available for anybody who was unable to attend today's session, or if you would like to reference back to it, please feel free. We'll give you an email address to reach out at the end of today's discussion. The other thing I would say is we do have quite a bit of folks in this meeting, so we would ask everybody, if you're not speaking, to please politely mute your audio. And if at any time you have a question or comment, please raise your hands. You can use the, I don't know if they're called emotions or captions at the bottom, but you can also, please feel free to enter anything in the chat, and we'll be monitoring the chat. Before we get kind of moving on through some of the background of the Personal Care Agency Oversight Provider Listening Session background documents, I would also like to tell everybody that, oops, sorry, I'm getting distracted by all the pop-ups here. Can you all see everybody I'm admitting here? I don't know what's going on, but my computer screen is kind of messing up here. All right, so sorry. We'll just go ahead and dive right in. I'm going to try not to monitor that and let my partners here do that. All right. Excellent. So today our agenda is, we just did back introductions. We're going to go over some of the background about why we're here today. We're going to briefly review some of the comments, feedback that we received from previous listening sessions. This is not the first listening session that we've had on this topic. And then there'll be an opportunity for you all to provide your comments or feedback, and then we'll move into next steps as we move forward with this initiative. So to start things off, for those of you who are not aware, in 2021, there was an LD 958, that directed the department to review the statutory and regulatory authority over home care agencies. And home care agencies is a little misleading, because really what they were talking about was personal care agencies, specifically that are currently fall under MSRA 22 subsection 1717. And they wanted us to examine whether the department had sufficient oversight and enforcement authority over those agencies, employees, independent contractors, and caregivers to ensure appropriate quality and safety of individuals receiving those services. So specifically, again, this was going to impact registered personal care agencies The department did embark in a review of this. But one of the things that I want to mention is that the scope of work did not include a rule of home health agencies that are licensed pursuant to 22 MRSA subsections 2141 through 2150. So this was really the personal care agencies that primarily do non-medical ADL, IA, ADL support that are registered only. Currently, right now, just to kind of highlight what the registration requires, is that all agencies, regardless of who you're serving and how those services are paid for, so whether you serve individuals who are receiving Medicaid services or main care, or their private pay, or maybe you receive reimbursement through the veterans, they must register with the Division of Licensing and Certification. So it's just a registration versus a licensing. Agencies must comply with background checks and hiring prohibitions. Only agencies participating in main care or state-funded programs. So state-funded programs, an example of that would be our Office of Aging and Disability Services, state-funded home-based care services that are typically coordinated through two of our service coordination agencies at this time, Seniors Plus or Alpha One. The direct care staff must meet PSS training and orientation requirements. But for those agencies that are not participating in main care or those state-funded programs, it is possible that your staff do not require to meet those training and orientation requirements. So following the original LD, the department completed their review, and it moved on, and there was legislation, LD 636 in 2023, I believe, was an act to authorize the Department of Health and Human Services to license and ensure the quality of personal care agencies. And I did add some hyperlinks down here for you if you'd like to go look at that legislation. So really, the first one was to study our authority and our oversight. And then the second one is to grant the department the authority to implement or promulgate rules to license the quality of those. In between all of that, the department really did solicit on several occasions or tried to elicit feedback from the existing registered agencies to identify any areas that would be a challenge for implementation or compliance, or to review things that the department should consider when moving forward with these rules. So with that said, we moved on with listening sessions in both 21 and 22. I also want to highlight the fact on the bottom of this slide, if you want to see the original report that studied the department's oversight and statutory authority of this initiative, you can click on the hyperlink below, and we will send this out following this meeting to get an idea of what that entailed if you're not familiar with that. But with that, I'm going to move this on to Karen Mason.
Thank you, Nicole. And thank you, Joe, for putting the link in the chat as well. And as Nicole said, I also put in the chat that we will make sure that the slide deck gets sent out to folks so that they have that, and they also have the links that you can review. So as Nicole said, what did we hear during the listening sessions? Next slide. So the themes that we heard during the listening sessions were some of these topics that you're seeing on the screen, which are, and I guess one of the things I want to make sure we also say is that during the listening sessions, we also invited not only personal care agency providers, but also individuals that were receiving the services and their family members. So these were some of the themes that we pulled from those listening sessions. So the first one you see here, I'm not going to read through all of the language here, but the first one was the importance of training and ensuring quality of the personal care staff, and strengthening the administrative process for establishing a personal care agency was another theme that we pulled from those listening sessions and comments. Also clarifying and strengthening the department's investigative and enforcement authority over quality issues and complaints. Improving compliance with required background checks and standards, And lastly, improving information for the public to help choose a personal care agency. Next slide. So that's what we learned from the listening sessions. And we engaged in a contract with Muskie to look at other states and how if they license personal care agencies and what those general themes are. So what we learned from other states is no surprise probably to anyone on this call that there are differences across the states. That there is a lack of common language for home care agencies. There's a lack of uniformity and minimum standards, not only in licensing requirements, but training requirements in the scope of practice and in standards of care. Next slide. And then also nationally, however, we did also discover that 30 states do require licensure of non-medical home care agencies, and more states are moving in that direction. Next slide. And some of this information, also the work that Muskie did for us, is really looking at the Home Care Association of America and pulling some of those themes and some of the code of conduct and other information from that association, of which maybe some of you on this call are a member. Next slide. And so what we discovered here is that, as you see, again, there are some themes here around compliance with state and federal regulations, insurance coverage, service agreements and plans of care is also a tenant, home care aid assurance, and emergency planning. And next slide, thanks, Nicole. And so what we did was we pulled all of this information together. And this slide here is really that culmination of what we heard from the listening sessions, what we discovered from other states, as well as the Home Care Association, around the ideas that we have for the regulatory oversight. And as you see here, and we'll come back to this slide, because the goal here for today's session is to really hear from you and your thoughts about what you also see as important as we move forward in drafting policies. So the first one is background checks, minimum qualifications for the administrator, written contract and service plan, policy on acceptance of gratuities and gifts, documented internal complaint process, content handling of client records, liability insurance, training and qualifications, accuracy in advertising and representation of services, and quality measures and accountability. So you can see here that some of these ideas are very, very specific, while others are a little more general in nature. Next slide. Also, we at the state have the availability to provide some technical assistance. We were able to secure some funds in order to move forward with a request for proposal or an RFP process so that we could hire a consultant that could work with you on a voluntary basis to help you assess your policies and procedures, identify risks of compliance, and potentially provide recommendations for success as we move forward in the next steps to promulgate this rule. And here we have the rulemaking timeline. As you see here, we're having the listening session today. And then we've got this January, February timeline of next year for proposed rulemaking. There's a lot that goes into that. And again, today's session is very, very helpful to hear from you, your thoughts on some of these ideas about what we should be looking at to put into rule. And then our anticipated adoption for these rules would be July 1st of 2024. Next slide. So now what we'd like to do is open this up for your feedback. As Nicole said at the top of the presentation, you can also provide feedback to our email address at the bottom. You can raise your hand. You can put some comments in the chat, but we really, really want to hear from you. All right, let's see.
I'm just going to leave this slide up, folks, for those of you who want to kind of review some of the themes that came out of our previous listening sessions, and also include some of the recommendations or compliant points that are being recommended from the Home Care Association of America, just to kind of jog your memory and generate any comments or feedback that you'd like to provide.
I'm seeing a question in the chat about an email address, and you'll see that on the bottom of the last document. It's actually, I think, Joe, you put something in there too. So you can see that you can email us at odes@maine.gov, or you can contact the Division of Licensing and Certification at dlrs.info@maine.gov. Those are listed in the chat. Looking through to see if there are comments. So there are comments in the chat. For some reason, I'm having a challenge scrolling down here. So someone has a question about, want to clarify, if we are not taking MaineCare money, does the in-home care worker need the PSS? So I'm not sure if somebody from DLC would like to address that. I will say, I think what we are looking for is uniformity across services. But I'm not sure, Joe, if that's something you want to.
Yeah, so obviously today we're not going to be giving out any particular legal advice, but I would direct people back out to the definition that the legislature has just amended. And I can put that link back in there to talk about what qualifies as a personal care agency. It is written fairly broadly.
So in general, I am seeing a lot of questions. And while we really appreciate your questions, what we're really looking for from this group is comments and how you feel about, some of those pieces that Nicole had up on the screen. Actually, you may have that up on the screen, but now I've got all the chat on the screen. So these ideas for oversight provisions, these are really, again, I said that earlier, the culmination of what we heard in the listening sessions, also what we heard from other states while we're thinking about putting provisions in rule. So if there are thoughts or ideas that you have, please feel free to share them. This is the time to do that.
I'm putting that, excuse me, I'm putting that legislation back into the chat feature. And so that's chapter law. And so that will give you some idea of what the new language is. And so just to piggyback on what Karen's been saying, before we move into a formal regulatory process that has a comment period, before we start that, we're really looking for your input about things that you want to go into the rule, things that would be helpful to clarify for you. And we will be taking those suggestions as we start drafting that rule. Those of you that have a lot of questions, and I know there's a lot of questions out there, because we have not engaged in the rulemaking process, it's very difficult to answer your questions on specifics.
Nicole, I will say that the PowerPoint slide doesn't appear on the screen anymore. It might be helpful for people to see those bullet points. So those would be potential topic areas for a rule. And I think what we're hoping to solicit from people are suggestions. Like the first one, as I recall, was background check requirements. So are there thoughts around what rule should address in terms of background check requirements? But we cannot at this point in time answer questions because we're in the process of drafting a rule.
And I do see a comment here that says, I think, oops, it keeps moving on me. I think it should include background check, written contract, home policies and procedures, insurance, PSS training within 120 days, service plan, and regular hiring process for employees. I would recommend that it not be overly regulated. Amy, thank you for that comment. Bill's comment says, I think this level of oversight and enforcement is long overdue and necessary. I applaud you for the way you've gone about researching this and think the list of areas you want to address is spot on. Jacob, you're making a comment about background checks should have trainings about the matrix. I'm not sure what that means. I'm wondering if you would be willing to come off mute and maybe clarify that, unless there's somebody from DLC that understands that comment.
I do. They're referring, I believe, to the matrix of disqualifying offenses, which is in the background check center rule. That's Chapter 60, main background check center rule.
And I
What
can
if
put contact information for the main background check center staff in the chat because they're always willing and able to help with questions about that matrix and their rule requirements.
I see that Nancy Colson has a hand up. Nancy, do you want to go off?
I had a question regarding paid family caregivers through the main care benefits manual. I know that there was a clause and waiver written at, post-COVID about a spouse being a caregiver, but it was written in a way it was under extenuating circumstances. And just if we could get some clarification regarding paid family caregivers covered under main care and what exactly that is supposed to look like would be very helpful.
There's an individual, David A. Has his hand up.
Yeah, hi, David Anthony from FCP Live-In. We're licensed or registered in a number of different states regionally. Is there a particular state or states regulations that you're looking at that you may want to incorporate some of their rules and regulations?
Again, I would say it's hard to say at this point to answer some questions because we haven't formally started the drafting process. I don't believe we're looking at a particular state. One of the things we are looking at is creating parity between DLC's licensing rules for PCAs and the way we license other entities in the state of Maine.
Okay, thank you.
And I see a question here. Somebody is asking, Jacqueline, you're asking about how do we access the technical assistance? That's a great question. Once we have gone through the process that we described earlier about securing a vendor that can assist us across the state with that, we will be back in contact with all of you. We will send out information so that you know that it's ready and available, and we'll have contact information for you. I will say that unfortunately that process takes a little longer than we all would love at this point. So it's probably going to be, what is this? This is October. It will probably be late spring before we have a vendor in place, and that's just an estimated time frame. But we will be back in contact with all of you to provide you that information.
It looks as though there's a comment from Ronnie Cohen. Wanted to make sure a comment was not missed. Specific, requiring specific training for caregivers will make it so that no agencies can hire independent contractors. Is this something that they're looking, that we are looking to get rid of? Another question is around non-solicitation agreement with employees in Maine. Jacob, you can go ahead and unmute yourself. I see you have your hand up.
Jacob, we see that your hand is up.
Can you hear me now?
Yes.
Okay. My name is April. I'm actually under somebody else's account for Heaven Sent Home Care. So sorry, I'm not Jacob. Anyway, I was part of one of the other listening sessions when you guys had started. And I guess I have a lot of opinions on what training should be offered. I think one of the first ones we had talked about mental health training, which ODES has now providing the mental health first aid, which we are encouraging our staff to go into because it's very, very important. And it's definitely one of those things that have been lacking in the training for PSSs and CNAs. So I don't know if you guys have thought about making those mandatory or including those in the PSS curriculum. Also, what we found as an agency is, yes, we have tons of sections and laws. However, there's not really a basic breakdown of how everything works. I've tried to get training through a couple different agencies, and I've been told that I am not qualified to take those trainings because we're not typical human service provider deliverers. So opening up some of those trainings for us, I think would be helpful as well. Learning about the sorry, my mind just went blank. The service authorizations, the policies for the care coordination agencies. We now have 3 in Maine: CareLink, Alpha One, and Seniors Plus, and they all do things a little bit differently, and having some insight as to how they want their operations to run and how we can support them and they can support us would be great.
April, thank you for those comments. And we're really glad to hear that you're taking advantage of those recent mental health trainings that NAMI is providing. others that have comments or ideas? Oh, David, I see your hand up.
Yeah, it says in the regulation about the cost of the licensing between $200 and $2,000. I would hope that we're going to be looking at the lower end of that, so we don't have a barrier to entry for some agencies.
Great, thank you for that comment. Again, I think we're seeing lots of questions in the chat, and for today's session, what we're looking for is your feedback and ideas around what you believe should be in the rule, and or not, unlike David just said, making sure that some of the provisions aren't so costly or burdensome for provider agencies, and what would those be? And April, I see that your hand is up. Did you have another comment, or is it just that you haven't been able to remove? Okay, thank you. That happens to me all the time.
The chat's moving fast, so.
So I do see a question in the chat about someone asking what the difference is between the process an agency goes through and what's to come in July. So what's to come in July is different than enrollment in that the Department of Licensing and Certification will be promulgating rules by which all personal care agencies would be required to meet those components of the rule. I hope that's helpful.
There's a question about a possibility of a question and answer Zoom about questions. So it might be helpful just to do a little bit of discussion about the rulemaking process itself, since people seem to be having some questions about that and why people might be experiencing frustration today because they're asking questions that we don't have answers to. And the process is, and has been mentioned, is that we're soliciting feedback now because the legislature has directed us to craft a rule about the licensing of these agencies. So the task that lies ahead of us at the department is to listen to this feedback, take the suggestions from the study that was done in the listening sections, and then we will draft what's called a draft rule that then goes out for review with the Office of the Attorney General, and then we will publish what's called a proposed rule. And when that proposed rule is drafted, that will go out to all of you, to all currently registered PCA agencies, and you have the opportunity to comment on that draft rule. It wouldn't be responsible of us to answer questions about the types of questions that folks are asking today because we don't have the content of that rule yet. And when that proposed rule is published and distributed to all interested parties for comment, that is your opportunity to make suggestions about what is actually written in the rule. So that's a very brief overview of the rulemaking process. When we get those written comments back, we at the department then are charged with the responsibility to review each written comment and decide whether or not to make any subsequent changes to a proposed rule before it's actually adopted. So that in a nutshell is the formal rulemaking process and why we can't answer those questions today.
Thank you, Jonathan. I think that's really important because when we say that any individual that thinks of a comment or something they'd like us to know or consider before moving forward with any rulemaking process, or any individuals that are not here and don't have the opportunity to share their thoughts today, when we're giving that email address, please know that it's not our comment or response to or in lieu of any formal rulemaking process. It's really an opportunity for you to share some of things that may concern you as we're considering some of these things to put into a draft rule. So please know that this is not in lieu of a formal comment period once those rules are proposed. This is really just to solicit your feedback, your thoughts as we draft those rules.
Right, I see the girls at home hand up.
Hi, sorry, my camera is not going to be on. It's automatically blocked.
That's okay.
So I have a couple of concerns. I am a very small personal care agency. We are not CNAs because we are just personal care. We are non-medical. And I feel like it sounds like the rules for a home health care agency is getting mixed up with the personal care agency. I know lots of companies do both. What I'm worried about is the little guy like me that helps families private pay, trying to keep our prices down because the price of care is crazy. And I'm worried about how I'm going to be able to keep my prices down and what rules are going to be in place, because I am non-medical, which means I have a really great group of ladies that just love to take care of the elderly. And I've had them, they've been with me for about 8 years now, quite some time. And as far as I know, where we're non-medical, we don't need the CNA training or the PSS training. We're not doing anything medical. We're offering companionship, help wash and dressing, etc. I know that some agencies do both. They do some of the main care, they have CNAs, and they have personal care attendants. So I'm worried that it's going to get grouped together and give me a bunch of regulations that I'm not going to be able to maintain. And the sad thing is weekly, I am turning people down because I can't help them because there's so much need right now.
Thank you for your comments. I will say, just to be clear, that this rule is specifically for non-medical providers.
Yeah, okay, that's good to hear, because I hear lots of people talking about their CNAs and how they train them. And I feel like if I had to have them be a CNA, I would have even less employees because first of all, they'd need all that training. But all right, I just wanted to make sure that that doesn't get lost somewhere, that we are non-medical. Thank you.
Thank you. David?
Yes, we are a paperless operation organization. So on the record keeping requirements, it would be helpful if it was stated that it could be electronic records rather than having paper records. I think that's going to make a difference for us.
Great, thank you. Others? Comments? Don't be shy. We're really looking to hear from you.
Hi, this is Danielle Nelson from Blessing Hands of Maine.
Great. Hi.
I have my photo up. I do not have my video on. I can relate to the lady that was just on a moment ago, as we are a new company, still fairly small. We are a non-medical personal care agency. We provide services across the board for private pay as well as main care. and other types of insurances. And we have a very high standard with all these topics. And I think one of my concerns as an administrator, I'm not an RN or a CNA. However, I've been in the field myself for 20 years. I have my PSS, my DSP, my CRMA. My concern as an administrator is knowing my competency to provide, services in our region that are very much needed, is that some of those qualifications for administrators are going to be that of which are similar to the medical, and like she stated, clarifying that we're non-medical. So I guess some of my concerns as an administrator is for myself and for other agencies like me, that we would still be able to provide quality services. Where is it going to go with those qualifications for administrators? Because we're not medical, we don't do home health yet or anything like that. And that's probably one of my concerns, is to make sure that, there's obviously a standard, and we hold that very high with what we do on all those other topics. Obviously, we're always wanting to continue education and things like that. But is there any feedback or thoughts from others? And I know that this topic came up last time, but I'm sure others have that concern as well.
No, thank you, Danielle. And we would welcome any feedback in terms of what your thoughts are around what those qualifications should look like, and anyone else on the call. And I understand that that's kind of a loaded question that many of you probably can't answer right off the top of your head. So just something to throw out there. It's good to hear that you're concerned about it, but we also would love to hear your feedback about what you think that should look like in role.
I don't know how to raise my hand.
That's okay. Somebody just talked, and just say who you are and go ahead.
I also run a small agency that does non-medical care, and I have the same worry trying to find employees and make it clear to them that they don't need to have the medical credentials to provide the care that they have been. And I feel like the agencies are being pushed out that do this type of work, that I feel like we're more of a gap filler. We're doing the showering, the bathing, the things that aren't necessarily there. And I wish there was a more clearer division, because somebody that has those higher credentials and paid for the schooling or the programs for that would expect a higher pay, and I can't compete. So I wish there was a clearer division between the non-medical and the medical care agencies. I think it's getting blurred and more blurred. And I go along with the two other ladies that most of the women that I have, or even gentlemen, I have a few that are wanting to be caregivers, wanted to get out of the medical field because there's such a push to just treat everybody like a number. And why they're coming to me is because they want to provide that one-on-one care. But then I feel like I'm going to have to tell them that they need to have a CNA to do so, when they're already have either took care of family members or have done this for years. And now it seems like the credentials are changing. So I think as far as going forward with the division between those two standards, this is a caregiving agency that does the personal daily living. And then this is an agency that does and provides the medical. And there be some clear lines of that. And that way, our little agencies that are taking care of the communities aren't being pushed out by these huge hospitals that are for profit. I'm not here to make money. And I feel like, I mean, I want to make a living, but a lot of my caregivers aren't with me to get rich. They're there to make a living, to provide the care that's needed because that's their calling. And that's where I think that a clear line needs to be drawn.
Well, thank you for that comment. And it looks like you have lots of agreement in the chat. So it looks like we have about 7 minutes left, our time together. Do folks have other comments they'd like to make? All right, I see a lot of comments about, yes, PSS should be the requirement and not CNA.
Karen, it looks like Nancy Colson has her hand up.
Okay, go ahead, Nancy.
As evidenced by all of our questions that we as agencies have, it's further solidifying the need for us to all be on the same page regarding unifying rules and regulations. And I appreciate the thoughtfulness in considering us all regarding this. I'm just wondering if there's a deadline for further questions. So after the meeting, after we've understood the expectations, who would we reach out to if things come up that we have questions about or would like to see implemented into the upcoming rules and regulations?
So
That is a
Nancy,
very good-
if you have comments or things you would like us to consider prior to drafting the rules, I would suggest that you email the odes@maine.gov with any comments or feedback that you would like us to consider before moving forward. And then as Jonathan explained, once the rules have been drafted, we'll actually move into a actual formal rulemaking process where proposed rules, and there'll be an opportunity for providers to participate in a public commenting period of time. The department will review those, make any adjustments to rules before moving forward with any adoption of rule.
Okay, thank you very much. That's helpful.
Welcome.
And just note maybe that to add to what Nicole just talked about was once it's within the formal rulemaking process, so there's a comment period, we sort of have to go a little dark in terms of not being able to respond to folks because of the formal rulemaking process. So we would, if we received any comments during that period of time, which again, you will be fully aware of, that we would most likely end up sending you a message, sending you back to the document and the location where you could provide your formal comments. So think of this listening session as more of an informal kind of conversation, a precursor, if you will, to the formalized process that Jonathan so kindly walked us through. So yes, I mean, again, if you're thinking of things right up until that point in time, we'll take those comments, but at some point just know, because we'll be drafting those rules, that there will be a point in time that you'll have sort of a next bite at the apple, if you will, to be able to provide your formal written comments.
Karen, I'm going to put the chapter bill back in the chat one more time and just let folks know if this is if you're just now participating in this listening session and haven't done previously. One of the things that I think might be helpful would be just taking a little time to go through that chapter of law. And what we're going to do as a department is we go through that law internally together and we think, does this provision make sense in the law? And providers will understand what it's requesting here. And if it is, we kind of copy and paste that right into the rule. If it's a little vague or it needs for us to expand on it, then we will try to expand on that so providers know what exactly the law requires. And as we do that, we think about, how else should we make this a well-rounded rule that otherwise speaks to what normal licensing protocols look like. So that's basically what we're going to do. And then we're going to put out a draft rule, just like Karen said, and we'll go into that formal comment period. And the difficulty with the formal comment period is, we don't get to do a lot of back and forth. We just get to accept comments. And so that's why we kind of provide this early listening so that we can really hear kind of broad ideas, themes. Somebody asked, what are we going to do with the chat? So we will certainly save this chat today, and this chat is going to inform as we start that drafting process.
We have just a couple minutes left, so if there's any final thoughts or comments, the floor is open. If not, we'll close today's session. Like I said, we can provide the recording for anybody who did not participate or anybody who requests it. Also, the slides will be mailed out to everybody who registered. And as Joe said, we will be saving the chat so that we can consider any comments or feedback as we move forward to drafting our rules.
All right, well, thank you all for joining today. We really appreciate your time. We had good participation. And again, we will send out the slide deck that not only has the links to some of the information we also put in the chat, but also contact information should you choose to send us some comments after this call. And if you or anyone that you know of that would like to receive a recording of this, please also let us know at odes@maine.gov. That would be much appreciated. Again, thank you for your time today.